At Sutter Orthopaedic Institute, we are focused on the needs of our community. Sutter Medical Center Sacramento is the proud recipient of the Health Grades Orthopedic Surgery Excellence Award from 2006 to 2010. Health Grades places Sutter Medical Center Sacramento among the top 10% in the nation for overall orthopedic services and among the top 5% in the nation for joint replacement. At Sutter, we are sports medicine experts, with a number of our orthopedic specialists serving as team physicians for local college athletic teams, the Sacramento Capitals, a professional tennis team, and the Sacramento Rivercats, a AAA affiliate of the Oakland A's baseball team. Each year, millions of children, teens, and adults visit emergency rooms around the country with a sports-related injury. While most injuries are common strains and sprains, others are more severe. Sutter Orthopedic Sports Medicine specialists focus on joint, bone, and muscle health, providing athletes of all levels with preventive care, such as recommending safety equipment to preserve the patient's health. When an injury does occur, our physicians determine the most effective and least invasive approach to care that will get patients back in the game.
The best way to avoid sports injuries is prevention, taking good care of a person's body, making sure they have good flexibility and strength, and maintaining a good health. The most common treatment options for shoulder injuries usually begins with non-surgical options. Anti-inflammatories, rest, physical therapy, and sometimes even injections can help. And the different types of injections vary based on the problem. But eventually, if things don't work out, then we have to go to surgical options.
I originally hurt my shoulder back in 2005. I was cheerleading on a competitive team and we were stunting, and a girl was up. I was holding her up like this, and when she came down, my arm went down with her, and all the force of her body kind of pulled my arm out and actually subluxed my shoulder. When I initially hurt my shoulder, I didn't know immediately that I had torn my labrum, but I definitely knew that there was a problem. It subluxed and there was a lot of pain, and I continued to have a lot of pain while I continued cheering. At that point, I decided to just do rehab and try and make it better, and then I moved off to college, and so I just kind of let it go. But then the pain continued to increase and things got worse, so that's when I decided to get it checked out again.
Arthroscopic surgery is primarily a type of surgery where we make little tiny holes and use a camera to go inside to do our repairs. The major advantage is the fact that we can do it with minimal invasion, no taking down of the muscles or interrupting the muscles, and so there's a lot less pain and quicker recovery.
Going into surgery, I knew that I was in good hands, and I trusted the doctor and knew that he would take care of the tear that I had, and everything turned out really successful.
So with Nicole's surgery, you have a ball and a socket joint. The socket sits here and the ball is out here. The labrum runs around the outside of the socket like this. Her tear is along the top part here. So we're able to place a camera in the back side of the shoulder inside so we can see. We'll place another portal here so that we can go inside and do some work, and then another one this way. By being able to place the anchor in here, pass in a suture and tie it down, we're able to then reattach that tissue back onto the socket. The standard recovery process is really no different from other surgical options. The difference, however, is that there's a lot less surgery involved. There's a lot less disruption of normal tissues. Therefore, all it really takes is standard time, rest, healing, and then the appropriate therapy to make sure that we maintain good motion and then return of strength and normal functioning and healing of the tissues. The limitations are pretty specific after surgery. Initially, we need to actually have the person not do much with it. They'll be in a sling, pretty much keeping their arm at the side. And this is important because we don't want to see them rip out the repair that we've done. However, very quickly, at least 1 week after surgery, we're going to start physical therapy. We don't want to see them get stiff, which is one of our major complications. Therefore, we're going to start early on to get movement and regain motion quickly and easily. Beyond that, return to sport may be as much as 4 to 6 months, but sometimes as quickly as 1 to 3. It all depends on what we've done, the status of the tissue, and how we've done the repair.
With my recovery process, I was in a sling for 4 weeks, but actually after about 4 days, I believe, after surgery, I was already starting my rehab process with physical therapy. But really my pain level was pretty low, and the rate at which I could move through my physical therapy was a lot faster than I thought it would be.
As with all surgery, there's risk of infection, stiffness, there's risk that the tissue doesn't heal, there's a risk that the tissue can re-tear. There's no guarantee that it can't. We're just trying to make it the way it was.
Now I'm more aware of, I guess, my own body and what it takes for the rehab process. Before, when I initially heard it, I sort of gave up on the rehabilitation process and said, oh, well, I guess it'll just go away. But Now I know better than that, and I know that now that it's fixed, I need to take care of my body.
Sutter offers specialized orthopedic care for arthritis, fractures, sports medicine, and trauma at its hospitals in Davis, Sacramento, Roseville, and Auburn. To learn more about the Sutter Orthopaedic Institute, call 1-877-361-2663 or visit us online at sutterorthopedics.org.